Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world to share their insights and expertise so we can all grow together. I am your host, Heidi Schock, and the co-founder of the Spotlight to Scale Accelerator, where we drive revenue for companies by making sure they're seen as the authority and go-to expert in their industry versus just another product or service. And today, I'm excited to be joined by Avi Singer with Showed Me, the CEO of Showed Me. So welcome, Avi. Thank you so much for your time today.
Thanks so much for having me, Heidi. I really appreciate the invite.
Absolutely. So let's start out. Can you share some, about you, who you are, what you do, and a little bit about your journey?
Absolutely. Yeah. So I didn't, when I started out, I didn't expect to have a technology company or have an online training platform. That's for certain. I actually went to school for psychology. I thought I was going to be a clinical psychologist. But at some point in undergrad, I realized, like, is that really how I want to spend my day? And I realized it wasn't necessarily what I was excited about. And I discovered organizational psychology, which was a lot more interesting. How do you motivate employees? How do you improve employee culture and things like that? And that's a lot more interesting for me. So I initially started down that path, had the opportunity to work for a couple of great technology companies here in New York, where I'm based, and spent about 10 years working in HR, organizational psychology, organizational development roles, and loved that. Went on my own in about 2014 to start a learning management platform. Not what Showed Me currently is. So, we can talk about how companies pivot and things like that along the way. But initially, the idea was a coaching and mentoring platform for organizations to use internally. So knowledge management, knowledge sharing within organizations. I won't go through the gory details of how we pivoted into compliance training, but in 2017, we pivoted into online compliance training for post-acute and behavioral health organizations. And that sounds like a very boring space, but we actually found it to be a very interesting and very exciting space. Post-acute is growing, nursing homes, home care agencies, home health, that's just a growing market. There's a need for good technology. And frankly, there's a lot of challenges in the space when it comes to staffing, retention, development, and things like that. And we saw a great opportunity to leverage our platform, both for compliance as well as ongoing education in our space. We've been doing it since 2017, and we absolutely love it. So I know it's a little bit of a long answer, but that's kind of a little bit about me and how we got to where we are today.
No, that's great. So you brought up healthcare. You shared a little bit about healthcare. So can you tell us more about who you serve and also the inspiration behind the name Showed Me? It's very intriguing.
Right. Yeah. So the name Showed Me actually came from an initial idea, which was sort of peer-to-peer learning. And when you ask somebody in an organization, like, how did you learn how to do pivot tables? Or Heidi, how did you learn how to run a podcast? It's typically somebody showed me. So that was the initial idea. And even when we pivoted into compliance training, and we thought, hey, maybe there's a title here that might be a little bit better. We didn't change that. We left it. People like the name. People like referring to us as Showed Me. Sometimes they'll say show.me or something like, or showed, which is fine. But we just like the name. We like the logo. We like the branding. And we've left it. So so that's a little bit about the name. In terms of healthcare, so really, I had this learning management platform, and I had friends who were involved in the post-acute healthcare space, so the elder care sort of population. And they came to me and they said, we have thousands of employees. We want to efficiently handle training and development, onboarding and orientation, all these training areas, compliance requirements. But frankly, a lot of it's still happening in the classroom. And I was floored by that. I mean, you think about technology and the evolution of technology, and I said, you're doing PowerPoints in a classroom in 2016, 2017. And the answer was yes. We just have not been able to find the right platform, find the right system. So I looked into it. I looked into the space, and you think about things as from an entrepreneur standpoint. Post-acute is an organic growing market, right? It grows 10, 15%. People are getting older. People are living longer. There's more need for care in that space, and therefore, you think about just, hey, how big is my audience going to be? My TAM, right? What's my opportunity? And that just continues to grow, and we've seen massive growth since we started 2017. Second was not a lot of competition in the market. A couple of incumbents who are doing what we're doing, but nothing particularly interesting or exciting. And then third, sort of selfishly, we like recurring revenue, and compliance training is an annual requirement. So those are the elements that took us in there. We've loved it. We've had a great time. We started in home care. We expanded into skilled nursing. I know, like, it's interesting. A HIPAA and OSHA doesn't seem that exciting, but we're excited by it. We're excited by the opportunity. We're excited by the work we get to do. We're excited by partnering with organizations to improve care. And that's an important part that we don't necessarily think about, but how do we, keeping people out with their patients as opposed to in a classroom, or the things we can teach them and things we can educate them on are actually pretty exciting. So we've loved the journey so far. And then actually, again, 8 years in, we feel like we're still just getting started.
Yeah, and this is an industry like I thank you for sharing all of that background because you found a need, a market that needs your services. It's recurring, right? They're
Yeah.
always needing to be in compliance. So there's
Hmm.
things in I know for some places it's called maybe like ICUs or whatever it is
Hmm.
about what they have to do to maintain
Yeah.
their licensing.
Yeah.
And it's not going away.
Exactly.
Healthcare
Yeah.
space is not going away. It's only growing.
Yeah. In the time I always tell people, in the time we've been in this space, I've never seen a regulation go away. So to your point, right? It's
Yeah.
not like people say like, oh, we need to expand infection control. Or for example, even looking aside from healthcare specifically, we have a number of states where we do anti-harassment training in those states, or gender sensitivities training in those states. We've never seen a situation where a state said, we think we should make anti-harassment training mandatory, and then come back a few years later and say, well, we don't think harassment's an issue anymore, so we're no longer going to do that training. So I agree. We've just seen the needs grow over the time we've been doing it, and that's just great for us to be able to continue to expand what we offer and what we do.
Yeah, and you've said that you really enjoy it. So there's a piece like there you'll hear people say when you're wanting to launch a business and or you decide to pivot, like make sure you love it, but at the same
Hmm.
time you need to make sure there's a need, right? You can't
Yeah.
just love it and there's no need and there's no long-term need for it too, not just a current
Yeah.
need, but a long-term need. Yeah, for
That's
sure.
something I talked a lot. Yeah, that's something I talked to a lot of entrepreneurs who like bring me their ideas, and sometimes it seems like a great idea, and you just say, but what's the market opportunity, right? Like it's nice, it's interesting, it's intriguing, it's useful, but like, is there a big enough market to support it? And that's something you have to be very cognizant of. So it's not just I have many times clients will come to me and say, hey, we have a need for X, and I just look and I say, that's a very unique need that you have, but I don't see that as something that I want to, necessarily add to our product roadmap because I don't see a big enough need. So it's something you do very specifically. So not every situation is one where we can, partner with them, or even, sometimes, like I said, when I'm giving guidance to other entrepreneurs, but I agree with you. That's a big part of it, is you have to see that, like you said, there's a big enough market, to support a business, and that there's a real market need for what you're offering.
Yeah, for sure. So, let's talk about challenges. What are some of the common challenges that you see organizations face with compliance training, and how does Showed Me's approach help overcome these obstacles?
Yeah, that's a great question. So when we started, that was the first question I asked. I said, okay, so you're doing PowerPoint in a classroom. Why are you not doing online training? Everyone else is doing online training.
Mhm.
And what we discovered is that, I think a lot of the employees in the post-acute space are unique, in that many of them will often be recent immigrants. English may not be their first language. Technical proficiency may not be there. There's other challenges as well. And the typical platform that might be used by somebody who's in financial services or somebody who has a higher education or something like that is not something that necessarily works for that audience. And that's really where we saw the unique opportunity. So number one was, can we create a platform that's really going to accommodate, some of these employees who have unique needs, whether it's a language need, whether it's technology proficiency need. We looked at the content that they were being trained on, and we were asking ourselves, like, is this really being written at a level that's easy for them to understand if they don't have a college education, or even sometimes a high school education. So how do we explain complex topics, clinical topics? So we really looked at the audience and said, this audience needs something that doesn't exist right now. And then the third was even from a support standpoint. We realized that like many of us need, we all need tech support at some point or another, right? But again, it's a unique kind of tech support that employees need. They need to be there with them along their journey, right? When they get stuck somewhere, how do we help them? Again, multilingual, so that if they are taking their training in Spanish or Mandarin or something along those lines, we can support that. So a very, very different type of need that our market that we focus on required, other, outside of what was already in the market, and available to our clients.
That's a good point that you brought up, is meeting the needs of your market, right? You have defined like what your needs of your people are, which may be different
Yep.
than other needs of other companies
Mhm.
and their product or service. So what metrics or feedback mechanisms do you utilize to assess the impact of the compliance training programs?
Yeah, great question. So there's some basic ones you can use, which are just simply, adoption. Are people actually using it? So we rolled it out, right? We sent out the notifications. Did everyone actually log in and take their training? Which is something we're very proud of. We've always had over 90% completion rates. And I have many friends who are in HR working for tech companies, financial services, accounting firms say, I don't get 90% completion rates. With people sitting at a desk all day and you're getting 90% completion rates, and people are out in the field on floors, who are really out, doing their job most of the day. So that was a very important metric for us. User satisfaction, we're constantly asking our users, what was the experience like? The technology, the training, all that. So we focus on that a lot as well. And then the other metrics we really partner with our clients on. So we'll talk to them about what does retention look like when you're using a platform like ours? What does employee satisfaction look like when using a platform like ours, or some of the other metrics that they might be measuring? Care, right? Are we helping reduce hospitalizations? Are we increasing patient satisfaction, family of the patient satisfaction? So those will have to partner with our clients on because they'll have those metrics, but certainly we'll sort of connect it with the training that we're doing that might be supporting some of the initiatives that they have. So very proud of both. So proud of the ones that were sort of metrics we own around adoption, engagement, all that, but also very proud of the metrics that we partner with our clients on in terms of improving care.
Those are great results. 90%. Many companies don't don't get those.
We take a lot of pride in it. It was, I'm the kind of person, I've always said when I started my company, so number one, I want to have a great company. I won't have a company where I don't think the company itself is great. And I love our employees. We have great employees. And number two, it's not a great product. I don't believe in that. Like if it wouldn't be a great product, I would have stopped and started something else. But when we saw that we could get to those 90% completion rates and high user satisfaction rates, that's really when I said, okay, I'm going to do this for the long term.
Can we talk about that for a minute? Like, I'm sure you didn't start out with 90% completion rates, and this is an evolution from 2017 when you started. So for those people that are listening, those companies, those CEOs, those founders, and they're wanting to scale, but they're still in that tweaking stage, what are some things that you did that helped you get to this point?
Yeah, I think it's a great question. And I think it's that, don't assume just because you think you built a great product, it is a great product. It's not. It's only a great product when it's being used as a great product. And I think we learned a lot. I mean, I would say, yeah, day one we rolled it out, it was crickets. And we're like, okay, why is it crickets? And we really spend a lot of time understanding what's working, what's not, what does our audience need, how do we connect with our audience? And I think our open-mindedness around it really is what's helped us in the long run, is that we're always available to listen and hear, and never just assuming, well, it's a great product, so you just haven't figured out how to use it, or you don't know what it's never that. It's really, if it's not working, then we sit down and say, like, why is this not working? Like, why are they not able to complete this activity, or why are they not able to log in properly, or things like that. We're constantly iterating on that, making it easier and easier through integrations and APIs, whatever we can do to make that user experience better. That's what we're laser focused on. Our pride, the platform, all that's very secondary to the other things. So we're not about bells and whistles and everything looking like beautiful and fantastic and all that. It's really, are they using it in the way that it was intended? Are they successful with the effort that they're making? And if the answer is yes, then we're happy. And I think everyone has to have that mindset. The mindset has to be, it doesn't matter what your product is. Like, that just, once you're in market, that matters very little. What matters is, is it being used, and are people happy with the way that they're using it?
Absolutely. And you mentioned what's working, what's not working. And I think that's important in all areas of your business. It's with your clients and customers, it's with your team internally, and your marketing too. So let's talk about that a little bit. When it comes to visibility, what are some of what strategies have you implemented to increase visibility in your market, especially when you first started, and even now as you're growing and scaling, and how the approaches that you've used for your visibility growth contributed to your company's revenue growth?
Yeah. It's not easy. So I would say, that the reason it's not easy is because I think that when you're launching a product, especially an enterprise, or B2B type of product, I think the most important thing is getting those marquee clients day one. It's sometimes easier to start with like small clients, but that's not going to get you the visibility and the credibility that you need. And sometimes you need to do whatever it takes. And I always proudly say, like, our first 3 clients that we ever had were great clients, very visible, well-known names, and we fought and struggled and pushed to get those clients on board, and did everything we possibly could to make sure that they were happy. And they're still clients today. 8 years later, they're still happy clients, I think, I would assume. And I think that's really the most important thing when you're in the B2B space is, making sure that your early customers are happy. They're going to be your referrals, they're referenceable. That's where you're going to get your quotes and your metrics and your references and your referrals and all those things. So it's easy to say like, hey, let's do some flashy, social media stuff, or let's create some videos and all of that. It's not. Again, well, I would say in my space, it's not, or even in the B2B space, it's really about credibility, and you build that credibility with your first, 5, 10, 15 clients, and make sure they're good ones, and make sure that you give yourself the time, to really make sure that they're happy, and you'll build your entire business just off of that.
So how does that brings me to a question of when it comes to visibility and you're just starting out, like when you've got your first few clients, how did you do that versus what you can do now that you've had those success stories? What shifted, like from what did you do, the grassroots method? Was it picking up the phone and calling, meeting
Yeah,
them in person?
it was picked up the phone and begging. Oh, sorry to cut you off. Yeah. Yeah. I still joke with them today. I have two close friends who are one of those first 3 clients that I had, and they were so I don't know the right word to use, but they were so hesitant to even have like meet with me, that they said, you can't come to our office. We'll meet at a Starbucks, somewhere between my office and their office. And they said, well, we'll talk there first, and then let's see if we actually let you know where our office actually is, because they were afraid, I guess, I would harass them at their office. And now we're incredibly close friends. But that's really what it is. There's it doesn't, like I said, it doesn't matter what problem you're solving or how much money you've raised or anything like that. Your first few clients, you're going to have to, again, beg, for lack of a better word, for them to give you a shot. And you're going to have to deliver, an amazing result, because it's something that's new to them. And hopefully, if you get those 2 things, you sort of get your foot in the door and have that positive experience, and realize that they realize no matter what, you're going to be there for them. That will then lead to those other ones, which just become easier, right? So it then becomes easier when you call somebody and say, hey, I already work with so-and-so, knowing that, full well, they can call them and check it themselves. So I work with so-and-so, nursing home, I work with so-and-so home care agency, or I work with so-and-so behavioral health organization. And that immediately gives you credibility, right? And then they know, like, okay, we're talking to somebody who knows our space, who knows what our needs are, knows what our requirements are. It's probably worth a conversation.
Yeah. So outside of that, once you grow, you've got your first few clients, now you're growing outside of that grassroots method. What have you added into your visibility strategy since then? And is there one that maybe you're really ready to double down on this year?
Yeah, great question. I think it's doing the same thing, but doing it in a more sorry, in a more passive way. So, case studies, testimonials, and things like that, and getting those out into the market, partnering with our clients on webinars and things like that. So it's really the same thing. It's saying, hey, I can't call 1,000 companies, and ask them to give me an opportunity for a call or a demo or things like that. But I can certainly get this information out there. And if it's intriguing and interesting for them, then they'll probably reach out. And I think that's really what it is. So if you do a really good job, again, on doubling down on the success that you've had, rather than having the outbound phone calls or cold emails and cold calls, you have it out there in the space. When people are looking for, hey, is there a better way to do onboarding in the post-acute space? Or is there a better way to provide training in whatever, in home health or hospice or whatever it might be? There's a good chance they'll find your stuff out there. And if you have really good materials, we've got a great marketing team putting out just absolutely fantastic content, it'll be there. And that's it, just the consistency there. We're fortunate to be in a space, like I mentioned before, where it's an annual requirement, and people know they have to do it annually. So if maybe this year they didn't sign up with us, but maybe they didn't have a great year with their current provider or how they're doing it, and then next year becomes another opportunity. I mean, there's so many situations where I've signed companies, 3-4 years after that first contact. And I know that the reason is not because I called them 100 times, but because throughout the process, we were putting really good content, really good information, really good case studies, really good materials in front of them. And they're like, okay, we should probably talk to these guys and see what they have.
Yeah. And like you said, it's all about consistency, right? Showing up consistently, putting your messaging out there and connecting with them. And then eventually consistency is going to come around at one point or another. It's going to work.
Absolutely.
Yeah. So I want to pivot. So let's pivot to AI. How is Showed Me leveraging AI? Because it's not something that's going away. It's only going to evolve and be a bigger piece of our industry. So how are you leveraging AI to enhance your compliance training programs? And then what benefits have you observed from this integration?
Yeah. So, it's always interesting when something new comes out. A few years ago it was machine learning, and then there were other things along the way. And people always like, okay, how are we going to use this? And I think our approach has always been never to just come out and say, okay, now it's Show.AI or the Show.me AI company or something like that, but really sort of understand that AI, in the same way that broader machine learning and other things in the past few years, search, if you go back 10, 15 years, really can improve your offering. Let's think about it from that perspective, right? So we're not becoming an AI company. People become AI companies, but let's see how AI can improve what we do. And we've found, many, many, many areas. So I don't want to give away all our secrets because maybe our competitors are going to listen to the podcast. I hope they do. But a couple, for example, are when I started out, one of the challenges was we have a pretty large content library, which we constantly have to update, right? So we have to create courses, that are meet the requirements, not only of the federal government, but, various states and all the different verticals that we're in. So I would say, 6, 7 years ago, when I first started really creating a lot of content, it was expensive. I would have to hire somebody to do the research. I'd have to hire somebody to do the writing. I would then have to hire somebody to create the course, do voiceovers. We translate a lot of our content, as I mentioned before, so I've got to do translations. So that's something where we've really been able to leverage AI in a very efficient way. So now you can have AI do a lot of the research. You can have AI do a lot of the writing of the content. If you build up a database where it can leverage and understand sort of how courses have to be created, we can leverage AI to create the actual courses and do the voiceovers and do language translations. So we've always been we've always had our eyes open into the market and said, hey, who are the partners out there? Who are the providers out there we can work with? So that's one area that's really been great for us. We've encouraged our engineers. Hey, you don't have to sit there and write millions of lines of code like you have over the last 2 years. So think about ways that you can leverage AI in order to help write code and make your code writing much more efficient and things of that nature. And then the core platform itself, there's a number of activities that are just consistent activities that happen, setting up training or making sure that training is focused properly or targeted correctly. So I would say that's how we're looking at it. I think most businesses that have a good business already should be thinking about AI and leveraging it and saying, okay, what are the current processes that we have currently in place today where we can leverage AI or even bots or things like that? Like I'll give you an example with bots. And again, I wouldn't like to use umbrella AI, but we saw that we were able to aggregate our tier 1 support questions. So, hey, what's my password? The video's not playing, or the common questions that you get. And if you can aggregate those together, then you can actually leverage bots to be much more efficient than a human in terms of responding. So I don't know what my password is, or my training's in English. Can you switch it to to Russian or Spanish? Things like that. You can train these bots to do much more efficiently than even we can. But again, it's not something that we're necessarily inventing or creating or changing our whole platform around in terms of AI or things like that. But rather, like I said before, just leveraging a lot of the new things that are out there to make our stuff and make our work much more efficient.
Yeah, how can you leverage AI to simplify and be more productive, right?
Absolutely, exactly.
That's what I'm hearing from a lot of people like you, founders, CEOs that I'm talking with. It's like, how do we use it? It's not going to replace the relationships. Like we still need our people and our internal teams for that, but we can definitely leverage it to create more efficiency. And like you said, that's a big piece. Like if somebody had to sit there and convert something to a different language, that takes a lot of time and resources where, AI can do it in a matter of minutes now. So let's keep talking about evolution. So how do you envision the evolution of compliance training in the next few years, and what role will Show.me play in shaping that future?
Yeah, so I think learning in general is going to have a very different look to it in the next 5 to 10 years. And we're seeing already, I think you look at even things like, universities, colleges, K through 12, I think where, everyone's on a different sort of learning curve or place within their learning. So, inefficiently, what we really do right now is we provide everyone the same thing. Right. So, hey, in let's use our space. Hey, you need to be trained on infection control. Let's just give everyone the same infection control training. But infection control training is very different for somebody who's new, maybe it's their first year, second year, and someone's been doing it for 15 years, right? And in general, just the entire idea around sort of, what should I be learning, right? As opposed to, what is required of me. So right now, the way we do it is we have a group of employees and we give them all the same exact training and say, hey, we set up all your training for you, go through it, get your certificate and go home. I think what we'll be seeing over the next few years, and that's why I mentioned K through 12, math, science, all these areas where everyone's gonna have individualized learning. And I think it's going to be the same thing in compliance, right? You do have to check that box, and you do have to make sure that you're taking your HIPAA and OSHA and corporate compliance. But I think what we'll be able to do is customize the specifics around what you're taking, based on your experience, based on your setting, based on the kind of patient that you're dealing with. So I'll use an extreme example, right, where I think this would make a lot of sense. So if Shobi knows that someone's dealing with a patient that has certain mobility issues, so the lifting techniques training we might provide to that employee is going to be very specific to the kind of scenario that they're dealing with, as opposed to somebody who might be dealing with a patient who doesn't have those mobility challenges or things like that today. So you still have to learn how to properly lift somebody and support somebody, but it varies or variations of the intensity of the type of training that'll happen. So at the end of the day, yes, they have to check the box. The government has to see that they've done their training. But in terms of really where we can enhance learning experience, it's by making it something that's very unique to their world and what they're dealing with today and the kinds of patients they're dealing with, as opposed to the generic training. So I'm excited for that. I think it's going to have, as much as most of our business is checking a box and making sure that everyone's compliant, I get most excited about improving care. I think that's an area where, there's so much opportunity there to improve care, to prevent hospitalizations, early awareness, things like that. And I think that's going to be a combination both of, good training, good platforms like ours, access to, patient data from EMR systems, but then this sort of AI piece where it says, oh, I hear something from the EMR system that says I should provide this training to this employee at this time in order to address that issue. So those are things that we get excited about.
Oh, it sounds very exciting. So, Avi, for some our listeners that are listening to you right now, how can they connect with you?
Easiest way is LinkedIn. I'm pretty active on there. I love the platform. I think it's got great purpose specifically for that. Just be able to reach out, connect people, learn from people. I leverage it a lot. I mean, I leverage it for sales a lot, but I also leverage it just for that. I find interesting people reach out to them, say, hey, can we get 15, 20 minutes to connect? And I've met lots of people. That's the easiest way. It's Avi Singer, on LinkedIn. Accept most connections. So, unless it's really going to be, I get off on their profile, it's going to be just some kind of sales pitch. But yeah, that's the easiest way, and always happy to connect with anybody.
Yeah, there's a lot of sales pitches on LinkedIn, but everybody's doing their thing. So Avi Singer on LinkedIn, go connect with him. Also showed.me, right, is your website, and that's SHOWD.me.me.
Yep.
So definitely check him out there as well, but definitely connect with him. Like you said, he loves connecting. He'll most likely accept it and have a conversation, right? Get to know each other. That's how relationships are formed. And you never know who Avi knows that you can support you and vice versa. So it's all about building relationships. Avi, before I let you go, this has been incredible. Is there anything else that you want to share that I didn't ask you or get to that topic?
I don't think so. I think your questions are great and really, give me an opportunity sometimes to think about our business. I don't always have the opportunity to sit here and have these conversations and say, how do we get here and what are we doing and where are we going? Just focus on the day to day. So this is a great conversation. And I hope lots of people listening to it and encourage everyone, to pursue the opportunities. There are lots of great opportunities out there. I would say, just going back to AI for a second, I think AI has made it easier, has really lowered the barrier to starting a company and being entrepreneurial, and I'm always excited about that. So hopefully people get something out of this conversation, and appreciate you having me on. Thank you so much.
Absolutely. Thank you for being with me today and spending your time. I'm really grateful. And thank you for you listening to Avi and I. And if you've enjoyed our conversation, then please, if you're listening from your favorite podcast platform, please leave us a 5-star review and share the podcast with people. Our goal here is to help everybody grow and succeed because, again, we're better together. And also, if you're listening to us on YouTube or you're watching us on YouTube, please subscribe and let Avi know that you heard him here. Connect with him on LinkedIn. And thank you to our sponsor, HLH Grow Solutions. If you're looking to grow your business through your visibility and scale to the next level and be seen and take your product or service to the next level by growing your visibility to get more leads and create more clients, then go ahead and go download our Spotlight to Scale blueprint. It's free, quick download. You can go to spotlighttoscale.com/blueprint. Avi, thank you again for being here today. For you listening, please go connect with him. He's Avi Singer on LinkedIn, and also showed.me for his website is showd.me. We'll also have all of his links inside of the show notes. Thank you, Avi. Thank you for listening with us and being here with Avi and I today. And we will see you on the next episode of the Business Growth Spotlight.